This is Conversation Balloons, a podcast of interviews with experts and friends about all things generational. I'm your host, Leah Farish. I want to start today's episode by asking you to consider that we will be talking about some specific sexual issues that affect children. And if that would be troublesome for you or someone in the room with you, you might want to put on your earbuds or wait for a more private time. Use your discretion, but it's an important topic, and we are so honored to have our guest today. Also, if you're interested after listening to this episode, my interview with Julia Mason called Tradition or Transition, episode 39, might also be of help to you. She's a pediatrician, and she discusses some of the same issues. Now, up to 9.2% of Gen Z now identifies as transgender. The CDC says that among 18 to 24-year-olds and among 25 to 34-year-olds, the number of U.S. adults identifying as transgender quintupled between 2014 and 2023. According to Reuters, in the year between 2020 and 21, there was a 70% increase in new diagnoses of gender dysphoria. About 45,000 girls in around 2022 were seeking donations from GoFundMe for double mastectomies. Jean Twenge, a scholar at San Diego State University, says nearly 10 times more Gen Z ID as trans than do Gen X. To help us understand this surge, Dr. Miriam Grossman will be talking with us today. Dr. Grossman is a board-certified child and adolescent psychiatrist in practice for over 40 years. Her latest book is Lost in Trans Nation, a child psychiatrist's guide out of the madness. We're honored to have you on, Dr. Grossman.
Good morning, Leah. It's great to be here with you.
Well, as I understand it, there are 3 stages to medical transition for kids: puberty blockers, then cross-sex hormones, and then possibly surgery. Can you walk us through each one of those briefly and explain why you find these objectionable for most kids?
Sure. Well, what puberty blockers do is they interrupt the normal process of development in young people. It is an essential part of human development to go through puberty so that your mind and your body mature into an adult. Now, mind you that I have said mind and body because the brain goes through huge changes upon exposure to the hormones of puberty, testosterone in a boy and estrogen in a girl. The brain develops, it matures, but it takes time. The brain of a 25-year-old is very, very different than the brain of a 15-year-old, let alone a 12-year-old. So what's happening in gender medicine is the idea that it's possible to be born in the wrong body, and that when a child or a teenager expresses the belief that that is the case and that their bodies are wrong, and that they, for example, they have a girl's body with a boy's brain. Extremely unscientific language, by the way. It's impossible. There's no evidence that such a thing is possible. Nevertheless, the kids are led to believe that it is indeed a normal variant, and they will express the belief that they are the opposite sex or some variant thereof. and that they do not wish to go through puberty. They might be taken by their parents to a gender specialist who will then put them on puberty blockers, which again uh, act on the brain to prevent the normal release of hormones that will get puberty going. And we have never done this before on normal kids. We know that a majority of them will come to terms with their bodies, with their biology, if they go through normal puberty. So you see, puberty itself, in many cases, is the cure to this condition. But gender medical experts, or so they call themselves, are coming in and they are preventing that normal puberty. And so those kids have a much lower chance of coming to terms with their biology and accepting their bodies.
Yeah, something like what, 96% of all kids who get on puberty blockers for transgender go ahead and move on to cross-sex hormones and maybe even surgery.
That's correct. We call it an assembly line. Because when parents take their confused child into a gender specialist, they're going to be told, you know what, the puberty blockers are just like a pause button. We're just going to pause this process to give your child more time to figure it out. Well, sadly, that is not the case. Because as you just mentioned correctly, that almost every child that is put on those blockers continues on to cross-sex hormones. The boys continue on and they are put on estrogen, and the girls are put on testosterone. And actually, you know, Leah, it really does make sense. You don't have to be a doctor or a PhD to figure this out. Because if you have a child that is confused about their identity, and then the entire world, all the adults in their world, their parents, their teachers, their principal, their guidance counselor, their therapist, and their pediatrician, all begin, they go along with this new identity. They call the child their new chosen name. They use the new incorrect pronouns. And they say, yes, we are going to pause puberty. We're going to prevent the development of breasts. We're going to prevent your voice from lowering and from growing facial hair. Well, then, yeah, I mean, you're affirming this false identity, and the child is more likely to go along with it.
It backs them into a corner. It locks them into that choice, which might be a very transient.
That's correct.
Choice.
That's correct. It may, from what we now know about this disorder, it most likely is short-lived and transient. The body needs to mature. The brain needs to mature. And the kids need to go through life. They need to experience more of life. And then when they get to early adulthood, many of these kids who were more feminine boys and masculine girls, many of them will end up being gay or lesbian, but they will be at peace with their bodies. Mm-hmm. They will have maintained their health, their fertility, their sexual response, and they will not be lifelong patients who need to constantly be going in for their medical appointments to get hormones, shots, surgeries, and of course they also deal with many other medical issues, cardiovascular issues, and other things as well.
Yeah, I was reading in your book about just the bladder issues that are often sequela to these changes if they go for a surgical option. Okay, well, let's move on briefly to cross-sex hormones.
Okay. So after the puberty blockers are the cross-sex hormones. We are exposing girls' bodies to abnormal levels of testosterone. We are giving them levels of testosterone that their bodies would normally not be exposed to unless they had some sort of an endocrine tumor. So in order to create in a normal girl, in order to give her a lowered voice and, facial hair, the fat distribution of a boy, broad shoulders, and other things, you have to really give her a lot of testosterone. And these high levels of testosterone come with all sorts of adverse effects: emotional instability, increased psychiatric conditions, increased anxiety. The list is very long. It causes a growth of the genitals. So when you have such high testosterone in a girl, it will cause the clitoris to grow, to enlarge. And that can be extremely painful. And even though initially this is one of the things that sadly these girls, these very confused young women, are led to believe that this is a good thing and that they will become more, similar to a young man when their clitoris grows. It is accompanied by a lot of pain when they're walking. And the other thing that testosterone will do is cause vaginal atrophy. So vaginal atrophy means that the tissue lining the vagina becomes very delicate and dry. It loses the ability to lubricate, and that is also extremely painful. That's essentially a symptom of menopause. They can actually begin bleeding and experience tears, vaginal tears that have to be surgically repaired. So there's all sorts, Leah. We could spend the entire time that we have together talking about these nightmare consequences of these so-called treatments.
We know that the next step is surgery. Briefly, can you tell what is involved and what people don't realize happens when you do these surgeries?
Well, probably the most common surgery for the kids who are identifying as transgender would be the double mastectomies, aka top surgery, which, as I explain in the book, is a euphemism, a dangerous euphemism,
right,
leading girls to think that, it's just top surgery, it's nothing that serious. I don't like my breasts. Many of these girls experienced, discomfort. Well, every girl probably going through puberty experiences some degree of discomfort with the changes of her body, the increased attention that she's getting from boys and men. A lot of girls have experienced unwanted touch. They've been molested or worse. And so they begin to feel discomfort or even loathing and hatred of their bodies. And so the most obvious feature of a girl's changing body are her breasts. And these girls are led to believe that they are really boys. They're told that if they're uncomfortable with their changing body and they don't like what's going on, they don't like their breasts, and they don't like getting a period, then they might very well be a boy. And that they should go ahead and experiment with a new name, new pronouns, and they should get something called a binder. A binder is an elastic compression device that girls can either get online or at Target or any other of these stores, and they wear it under their clothing, and it compresses their breasts to a degree that it can affect their breathing. It causes pain. It causes rashes and other adverse effects. And the binders, if they're worn day after day, month after month, they begin to create permanent changes in the breast tissue. And so we know that girls who are wearing binders for an extensive period of time, they get to a point where their breasts no longer look normal. They've been flattened. They don't look like the breasts of an adolescent. They look like the breasts of an elderly woman who's already had children and nursed. And so the binders, which you do not need a prescription for, and some schools are giving out binders for free to girls without their parents being aware. Parents must be aware that this is going on. So you asked me about the surgeries. In this country, we are doing double mastectomies on girls with healthy breasts as young as 13. And we have data from various hospitals. Oh, I want to mention an incredible organization called DoNoHarm.org. And I happen to be a fellow at Do No Harm. Do No Harm is a member organization of doctors and other health practitioners, as well as citizens, non-health practitioners, who are fighting against politics in medicine, primarily gender ideology, but also DEI in medicine, diversity, equity, and inclusion. These are all ways of bringing political movements, ideology into the medical field, and it harms all of us. So Do No Harm, the reason I'm bringing them up is they did an in-depth study of these surgeries that are going on in this country, gender surgeries. And they published the alarming data that showed that thousands of kids are having so-called top and bottom surgeries, meaning double mastectomies and genital surgeries that forever, I don't like the word mutilate, but they forever are changing the bodies of these kids in ways that are disfiguring, in ways that will impact their normal functioning.
And not reversible.
Of course, irreversible. And sadly, some of these kids, the girls especially, are so misinformed that they think that their breasts could grow back. Obviously, a girl who has had her breast removed will not be able to grow them back, will never be able to nurse, will experience, instead of, positive sexual arousal, from her breasts, she will experience pain and numbness, and sometimes have terrible side effects as a result of what they do is they remove the nipple and then they sew it back on. And this, of course, can cause a lot of problems. These are experimental surgeries, okay, that we are performing on young people who have a mental illness, who are led to believe that these surgeries and medications are going to cure their mental illness. That the reason why they have anxiety and depression and self-loathing and other issues, and by the way, many of them are autistic, and they're led to believe that they are going to feel so much better, that this is the answer, that they will feel good about themselves. They will have a good life. They will have friends. They will find a romantic partner. They just have to go through this process, which is called transition. Well, nobody can transition to the opposite sex. It is impossible. And so it is fraudulent. It's a massive fraud. And the parents are also being deceived because they're being told the same thing. Plus, they're told that if we don't do this for your child, then we're risking that they will commit suicide. And we know now.
Well, and actually, you cited a male to female survey regarding satisfaction after the process, and less than 8% reported being very satisfied.
Yeah, that would have been, I believe you're referring to the genital surgery in which the penis is sliced open. Forgive me for this disturbing graphic image, but it is sliced open and then uh, uh, basically inverted and used to create a faux vagina. It's a very, very complicated surgery. It's an experimental surgery, and there's so many, as you can imagine, uh, dangerous side effects. Anything from chronic pain, bleeding, dangerous infections. There have been deaths that have been reported. Difficulty urinating, inability to urinate, having to have an indwelling catheter for many months. It's a nightmare, trust me.
Well, it sounds like all of this could be very expensive. 77% of the mastectomies are self-pay and cost about $30,000. So I imagine a lot of these processes are self-pay, or does insurance cover these changes for
So in
kids?
some instances, yes, insurance does cover. In some instances, it depends on the state. Medicaid might cover it. And then you have to keep in mind that parents might cover it because they think they're saving their children, their girls' lives.
Mm-hmm.
There's also, as I described in the book, a lot of the girls will go online to GoFundMe and they will try to raise the money that way.
What percent of parents of children who go all the way through surgery would you say are supportive of what their kids are doing?
That's a great question. We don't know. And plus it's Leah, it's actually a very complicated question because I've talked to a lot of parents who have signed on the dotted line, but they did it just holding their breath. Okay,
Right.
so do you describe a parent who have signed on the dotted line for blockers or cross-sex hormones or surgeries? Do you describe them as supportive when it's done under such duress and they're so worried that they're doing the wrong thing, but on the other hand, the experts have told them that this is what's going to save your child's life? I would
Yeah.
argue that that's not supportive. I would argue that they have a gun to their head.
Right. Um, so it's you dispute the assertion that um, suicide is a likely possibility if the child is not allowed to transition. Talk about whether suicide is a real risk here.
Well, at this point, we have enough data to indicate that the kids who do not get these treatments um, don't have a higher rate of suicide than the kids that do. In fact, the truth may be the opposite. It may be that the kids who get the treatments have a higher risk of suicide. And I want to explain to you. You see, like I said, the kids are told that this is going to be the answer. first the blockers are the answer, then the cross-sex hormones, then the surgery. And many people who have gone through that process are explaining that with each intervention, which starts with the new name and pronouns, by the way, with each intervention, there's an initial euphoria. There's a feeling of, now I'm really doing something. Now things are going to be different. I feel so hopeful. I feel so good. And the adults around them may mistake that to mean that it's the intervention that caused the improvement, where actually it's the sense of hope and the sense of having a sense of control and being listened to that is helping those kids temporarily feel better. But you know what? After a while, it's not enough. The new name and pronouns and using the opposite sex bathroom isn't enough. And they continue to feel anxious and depressed and to be self-harming, etc. Because we're not addressing their underlying psychiatric problems. And so they go on to blockers, and they might initially feel relief that their body is not going to change. And then they go on to the cross-sex hormone, and the girls, their voice drops, and they think, wow, because that happens quickly. That can happen within the first 3 months of going on testosterone. And they might feel, this is great, my voice sounds like a boy's voice. I'm on my way. I'm on my journey. At the end of this, I'm going to feel so much better. But then that doesn't last, you see.
Right.
And one person explained it very, very well, an adult who went through this process. And she said, it's like you open up with each Christmas present, you feel this rush of excitement and euphoria, but then there's no more Christmas presents to open up.
Ooh. Wow, that's intense. Let's talk a little bit, because I really appreciate the compassion you show for the whole family, with someone who is a youngster going through this. The parents, you have very specific, helpful advice based on hundreds of families who face this. I notice one of the themes of that conversation that you have with a child who initiates this topic, you encourage the parent to do everything they can to slow down the decision making. And one thing I thought was so sweet, you said to say to parents, for parents to say to their children, be patient with me. What else should parents do in those initial conversations? And is there anything they should, any bright line they should draw on saying no?
I talk about how for many families, it's just a out of the blue proclamation at dinner while you're having your lasagna, and suddenly your daughter says, Mom, Dad, I have something important to tell you. Everyone else knows. They know at school, my therapist knows. So it's time for you to know that I'm not your daughter, I'm your son. And so I describe in that chapter, I actually have the conversation, a model conversation. And I'll just give you a few main pointers, but I would like your audience to, at least if you're going to read one chapter or listen to one chapter, I probably should be that one. Hopefully you will not lose control and start and respond, by screaming or becoming, deeply, angry or emotional and saying stuff like, are you crazy? Where did you hear this? This is just, I can't believe you're saying this. You don't want to do that. You don't want to do that. You can do that later. And I suggest to parents that they that they actually do vent and share those kind of emotions later on, but not with somebody else, with your spouse or with your sister or with your friend or whoever, but not with your child. Because you have to know that your child, this is a very, very life-changing conversation, an event for your child, telling you this information. Your child has planned for it. Your child has probably talked to other people about how to do this. She has, I'm saying she because these days most of the kids that are in this sort of a cult, it is like this has similarities to a cult. There are 30 to 40% boys, but a majority are girls, teenage girls. She has planned for this. This is a big deal, and she really wants to get it right. So, and also I would emphasize that your kids, even though it doesn't seem like it, your approval is important. Not only on this subject, on every subject. Kids want their parents' approval. Even when you're an adult, you'd like to have your parents' approval, right? And love regarding decisions that you make in your life. So keep in mind that if you respond with this kind of sudden, are you nuts? I can't believe I'm hearing this. Who told you this? And a lot of negativity. It's going to work against you. What you want to do is to, at least with your child, remain curious and open. So you want to say, oh, really, this is interesting. Tell me more. You want your child to do most of the talking, and you're going to be listening. Okay, you're going to be asking a lot of questions and coming across as a curious but loving parent. And you want to say things like, I can see that this is really important to you. And if it's important to you, it's important to me. And I'm going to learn more about this. Now, if your child is asking you to use a new name and new pronouns, you want to put the brakes on that and say, whoa, this is interesting. I want to hear more about this name and why you picked it and what it means to you. But your name is something that your father and I picked very carefully. And it means a lot to us. And we can talk more about your name and about this new name that you've picked. But right now, this is something that we're not willing to go with. And we're not willing to go with different pronouns. And you want to remind your child that people who love each other sometimes disagree. And they sometimes disagree about big things. And you may have, a husband and wife, or, a brother and sister, or a parent and a child. One of them is MAGA, and one of them is, Bernie Sanders. You'll see. Yeah. And you know what? That happens. It happens quite a lot. And that's okay. It's not the end of a relationship. You see, because, Leah, what I want your audience to understand is that along with all this ideology of telling kids that you can be born in the wrong body, is that kids are indoctrinated with the idea that anybody that doesn't support your new identity is a bad person, is someone who doesn't love you. Mm-hmm. That's what they're hearing. And, it's a terrible thing. It's a way of placing a gigantic wedge between children and parents. It's eventually, the goal is to destroy the nuclear family. We're not going to have time to discuss that, but Parents have to know that that's a part of it. And that,
Well, and the secrecy and the turning the child away from even confiding in the parent, presenting that this whole thing to them as a fait accompli is something that I think parents are not aware of. They don't realize the level of distrust and secrecy that is created in the child's mind around this. And is it partly possible even because of the CARES Act and I was talking to a nurse about how they don't let parents into the treatment room even or exam room in the ER even when there is an emergency. They don't let the parents in with a child because it's a privacy
okay, well,
issue. This is new.
actually, this is all because of what's happening at the American Academy of Pediatrics. For many years, it's actually not that new to request a parent to leave the room when the patient is an adolescent, and they probably are doing it even with children. Parents do not have to leave the room. This is about placing a wedge between parents and kids, and that is why parents have to really work at holding on to the child and loving the child. The relationship with the parent is the child's most important relationship in their life.
And you're saying that as a psychiatrist.
That's correct, of course.
Yeah, sure. Well, I noticed you also said don't if the daughter wants a binder, you discourage going to that
Very
extent.
much.
Yes, maybe a sports bra, but a binder can have some permanent
Very,
effect.
very much. Yes, the parents should, if they find a binder in their child's room, or if she says she wants one, they have to, patiently but firmly explain that they've looked into it, and these devices are actually harmful, even if they are worn according to directions which says no more than 8 hours a day. Even if they are worn less than 8 hours a day, they can still be harmful. They can cause pain, rashes. They can actually cause broken ribs, shortness of breath, girls,
Back problems.
all sorts of things. And girls who, they may not be able to participate in physical education because their breathing is affected. There's a long list of problems. Yeah, you can get a sports bra, but those binders are dangerous.
I really appreciate your emphasis on the reality. First of all, emphasis on reality. The reality that at the cellular level, we are male and female, and I think sometimes kids and even adults get the impression that if you take a systemic drug like a hormone or something, it changes you at the cellular level, but that's not true. Your chromosomes will always be those
Well,
chromosomes.
absolutely correct. Your chromosomes cannot be changed. And furthermore, those chromosomes have an impact on the functioning of every cell and therefore every organ system. And when your organ system is female, it is not expecting to have these astronomical levels of testosterone in your body. And, we still.
And that's something that should be explained to a child because I don't imagine that the school counselor or the activist nonprofit is going to explain that to the child, that actually you will never change your sex.
Well, to the contrary, Leah, what they're doing is they're going along with the new identity, the new name, the new pronouns, the medical and surgical interventions, which endorse this idea that you're the other sex. I mean, in my opinion, if you call a girl by a boy's name, now I'm not talking, there might be nicknames, there might be gender neutral names, but if you go along with male names and male pronouns, that in itself is affirming this false idea that you're in the wrong body.
Mm-hmm. Yeah, let's talk about some, a strategy that I read regarding smoking that was effective. They said of all the ways to try to convince kids not to smoke or quit smoking, the best was to expose to kids the financial incentive that tobacco companies have to get you to try smoking and then be addicted. That the advertising companies and all are captured by this profit motive, and they want to make money off of you. And teenagers understand that. And I wondered, are there facts that you've become aware of that show that there's a financial incentive in the medical community and the advocacy community that makes money off of this? And is that something we should talk to kids about?
Well, I think that could be one thing among many that are presented to kids, not, of course, all at once. You don't sit down for an hour and just pile everything on top of them. The biology, the truth about male and female, and that humanity is divided into male and female. We are mammals, and mammals are either male or female, because they're hearing this argument that sex and gender are on a spectrum, and male and female are only two options at each end of the spectrum, and there's a infinite number of options in between, and all this sort of, it's rubbish. So we need to present to them the true biology, and there's so much online. And I have on my website, miriamgrossmanmd.com, I have a resource page where you can find a lot of this information. So yes, for sure the biology, and for sure I would add the information that there are now a whole population of detransitioners, young people who have gone through this process. Some of them had the medical interventions and surgeries, some did not, but they have turned around and realized it was a big mistake. And actually what was going on is that they had psychiatric, emotional issues that needed to be taken care of. And those people are extremely, the detransitioners, very articulate and bright young people. And they have made videos. They're on YouTube, they're in documentaries. Sit down with your child, depending on the age, and say, you know what, we're going to take some time together and just watch this documentary together. Mm-hmm. And then we'll talk about it. If your child is still living in your house and you're supporting them and you're paying for all their needs and driving them around, etc., you have, you can draw the line and you can say, you know what, this is something that we're going to do. You give me some times, give them a little bit of power. You tell me, what time is good for you. Give me a bunch of times that will work, and we'll do this together, and then we'll discuss it. I think that's important, because they're going to relate to a young person who's 19, 20, 22, who went through this process and has, a young woman who has a lowered voice and facial hair and has had her breasts removed, talking about it.
Yeah. Well, let's spend just a few more minutes before we close on the new developments in the law and the agency changes that we've had since President Trump came into office. And 27 states have now banned at least transsex surgery. I don't know the wording of each of those states' bans, but it does seem like your view is getting traction. It's certainly the prevailing view now in Europe, which pioneered this kind of thing, and the Dutch protocol and everything. Do you have any comments on the new developments and HHS's report that just came out?
Yes. Well, there's a lot of good news. We are certainly winning this battle. It's not over. There's a lot of a lot of things that we still have to fight, trust me. But like you say, there are a lot of states now, 26, 27 states, and they not only have addressed this surgery, but the medicalization, the hormones and the blockers as well. So that is good news. And it is true that a number of European countries and the United Kingdom have done a 180 in this area. Sweden, Norway, Finland, countries that were actually in the forefront. They were the pioneers of so-called gender-affirming care, but they recently took a close look at the data and concluded that we don't have evidence that gender-affirming care is helping these kids, but it is harming them. Now, there are, just to correct you, Leah, there are still countries in Europe that are full steam ahead with this. Spain, Germany, are still going with the gender affirming care. So there's a debate. Okay, there's a debate right now. Yes, with President Trump and his executive orders and the Health and Human Services report that came out recently, we are people on our side of this who want to protect children and families are very, very pleased. We're waiting for the Supreme Court to decide on the Skrmetti case, which is a case that was brought in front of the Supreme Court in which the state of Tennessee that passed legislation banning gender-affirming care in minors was taken to the Supreme Court by the Justice Department and a number of families. So we are waiting to see what the Supreme Court is going to decide on that case. There are quite a few lawsuits of young people against their doctors and therapists for fraud and malpractice. We'll see what happens with those. And there are a lot of good things happening. However, on the negative side, we do still have powerful sex education organizations getting millions of dollars from our tax dollars, and that are indoctrinating kids with these harmful ideas about being born in the wrong body. We still have many school districts that are secretly behind the parents' backs, socially transitioning the kids, meaning using new names and pronouns and allowing the child to essentially live as a boy or a young man in high school, using opposite sex bathrooms, being dormed with the opposite sex on school overnight trips, and keeping this from the parents if the child requests it. Now, that is a major problem. There are lawsuits regarding that as well. So there's still a lot to do, and parents still need to be vigilant, and they need to be informed.
Yeah, I would be interested to see if the FDA changes or if it hasn't approved some of these drugs for the transitioning, if it would get involved this way in slowing things down, and whether Medicaid will continue paying for some of these procedures. Well, any final words before we close, Dr. Grossman?
I want your audience to be educated. That is what will give you the understanding and the tools to deal with this. I want parents who are in this situation with their children to not be isolated, to meet and join one of the many groups that exist for parents. You have to be supported. This is, for most parents, this is the most difficult thing they've ever been through in their lives. So I would say those two things. Do not lose hope. Kids do get out of it. Many kids do get out of it. And to remain loving and devoted parents as hard as it may be, try and do that. If your child has become estranged, which happens sometimes, continue to, if you know their address, their phone number, continue to text, continue to say happy birthday, we love you, Merry Christmas, we love you. Keep the connection going. But hopefully, with the information in my book, it will never get to that point for you.
That's wonderful. Thank you. Thank you for all your work on this issue and for all your time today. Everyone, check out miriamgrossmanmd.com and donoharm.org. And we will continue to follow this subject with concern and interest. Thank you so much.
Thank you, Leah.
Subscribe and review Conversation Balloons on your favorite podcast platform. Find me at leahfarish.com and on Instagram at LEAHFARISH.